Welcome to the Virtual Village Hall. My name's Jim Pollard, and I'm from the Men's Health Forum. And this week is Men's Health Week, which runs every year in the week that leads up to Father's Day. And the theme this year is it's time for your MOT. And the reason we've picked that theme for this year's week is that obviously after the last couple of years we've had with the pandemic and everything, lots of people have been leading lives quite differently to how they have been using them, and now we're kind of trying to come out of that. There's all sorts of new sort of challenges, really, and one of the big challenges is that we know that the NHS has missed thousands of serious diagnoses because people simply weren't going to the GP for very good reasons over the last couple of years. So we're very much encouraging people to look at their own health, physical and mental, and if they feel that they need to see someone, to absolutely do that. We know it's very difficult. The NHS remains under pressure, chronically underfunded and understaffed in some cases, but it's really, really important that we try and use the service again. So that's the reason why we're pushing the idea of doing a do-it-yourself MOT. You can find a do-it-yourself MOT on the Men's Health Forum website. And today I'm going to sort of run through a little session with you, which will cover some of the issues. Can you stick the slides up for us, Victoria, please? Thanks very much. So this is the Man MOT training session from the Men's Health Forum. So let's see if I can work the slide deck. So the Men's Health Forum is the leading charity supporting men's health in England, Wales and Scotland. The reason we don't operate in Ireland is that there is a separate Men's Health Forum which covers the entire island of Ireland, north and south, and we operate in Britain. And the aim of the forum is pretty simple. It's that all men and boys have the information, services and treatment they need to live healthier, longer and more fulfilling lives. Because despite the advances that have been made in healthcare over the last centuries, men still live considerably shorter lives than women, and many too many dying prematurely, as we'll see. My name's Jim Pollard. I've been writing about men's health since I had cancer when I was in my 30s, which was a bit of a time ago now. And it took me by surprise, not something that you're expecting to happen at that time. I wrote a book about it, and I've been interested in and writing about men's health ever since. I'm currently the editor of the Men's Health Forum's website, and write their publications and booklets as well for them, and obviously involved in their training team, which is why I'm here today. So 3 simple objectives for today. We'll find out more about some of the key issues in men's health, some of the key actions that could add years to your life, and how to overcome some of the barriers. You can ask questions throughout, and Victoria will be making sure that I see them. But if you want to ask questions anonymously, and sometimes people do, we've got this website Slido. You can go to slido.com and you can enter the code 616765 to go to our page, and you can ask an anonymous question there. Obviously, remember we're not doctors, so I'm not going to diagnose anything, but we'll try and answer your question or point you in the right direction if we can. And that applies to all questions, which I'll try and get onto later on. So first of all, I've got a question for you. I don't know whether I'll be able to see the answers. I'm hoping some of you can access a chat function. through whatever platform you're joining today, because I've got a question for you, and it would be great if some of you could answer it through whatever platform you're on today. And it's about the London Borough of Kensington and Chelsea, which is, as you probably know, is one of the richest boroughs in the country. It's the borough where Grenfell Tower is located. And the question is, how many years longer do the richest men live in this particular borough compared to the least well off? If you want to have a go at that question, stick your answer in your chat, and we'll see how we're doing. Got 5 so far as one suggestion. Anybody else got like to hazard a guess? 10? Any more? 15? It's not supposed to be an auction. Okay, guys. Well, thank you very much. Thank you, Jamie, for 8. So I think I'm going to surprise you. Luke, 5. In the London Borough of Kensington and Chelsea, the richest men live 22 years longer than the poorer men just down the road, just round the corner. We are literally talking area of a couple of miles in London. Less than a bus stop between the poorer areas and the richer areas. And the life expectancy gap is absolutely phenomenal. It's 22 years. The richest men can expect to live to be 94. The least well-off men have a life expectancy of 72. So absolutely massive difference. Now, why am I bringing this up? It's not because I'm saying, we all should get as much money as we can because then we'll live longer, although obviously that helps. My point is that if the poorest men had access to the same resources and services that the richest men have, there's no reason why they can't live to 92. This statistic proves that there's no biological reason why men are programmed to keel over at the age of 70 or 75. And it's quite possible there's no genetic difference between the men in one part of Kensington and Chelsea and the guys that live round the corner. It's purely about access to resources. And if everybody had that level of access, there's no reason why all men shouldn't be able to live to beyond 90 years. There's quite a big gap in life expectancy, even if you look at rather large chunks of the population. So if you look at the life expectancy gap between the richest 10% of men and the poorest 10% of men, so we're talking about 10% chunks of the population, which is several million people. If you look at that, there's still quite a big gap, 10 years between those two groups. So, within the health inequalities within men are quite phenomenal. So the function and purpose of the Men's Health Forum is really to try and narrow that gap. And this is the kind of key message, really. The main reason why I guess the forum exists is that 1 in 5 men will die before they're even old enough to retire. So 20% of male deaths occur before the age of 65. And obviously now the retirement age has gone up a bit. We're thinking of the conventional retirement age. Now the retirement age has gone up a bit. There's even more men who are not making it through to retirement. And everybody I'm in my 50s, everybody in my age bracket will know people who've died before they're old enough to retire. And I'm sure most of you out there do as well. So that's what the forum's here to try and do something about, really. So what is it that's causing these premature deaths? What is it that means that men in some parts of England live 20 odd years less than men in other parts? One of the main killer of men is heart disease. 75% of premature deaths from coronary heart disease are male. It kills more men than women. And on average, and this is the reason for those deaths before the age of 65, men develop it 10 to 15 years earlier. Lifestyle and stress make a big difference. And the slide says even watching penalty shootouts. And the point there is that there was some research done in the 90s in Holland. And on the day that the Dutch football team were knocked out of Euro '96 on penalties, heart attack deaths in the Netherlands went up by 50%, attributed largely to the stress of watching football. Obviously, the point there is not that you shouldn't watch football. The point is that we need to be fit enough to get through the basic stresses and ups and downs, even of everyday life. You know, it's not that you shouldn't watch football, but you need to be fit to watch football, or reasonably fit. But it can also, but it applies to any other health condition as well. The sooner you get help, the better. In the case of the penalty shootouts research, many men waited until after the penalty shootout finished, even though they've got searing pain in their chest. As I say, heart disease, minutes count. When it comes to cancer, weeks and months can make a massive difference. So it's really important to go and see someone as soon as you're concerned. What are the predictors for future heart disease? High blood pressure, high cholesterol, erection problems, all of those can be future predictors. We are able to measure our blood pressure ourselves, or you can just walk into a GP and find one of those machines. High cholesterol is a little harder to measure yourself, which is one of the reasons why it's important to get an NHS health check when you're offered one. And men in their 40s should be being offered NHS health checks, and these health checks should be coming back. They were paused during COVID, and they should be coming back. So if you're in your 40s and you haven't been invited for one, you want to think about asking your GP for a NHS health check, and I'll mention that again. And lastly, a warning sign that most men are quite aware of, which is erection problems. That can be an early warning of heart disease, also a warning sign of diabetes and depression and other conditions as well. So again, if you're affected in that way, it's worth getting some help, talking to someone about it. Doctors hear about these problems every day. There's nothing to be embarrassed about that. Mentioned heart disease. The other biggest killer of men is cancer. And men have a 37% higher risk of dying from cancer, and a 67% higher chance of dying from cancers that affect both men and women. So if you look at cancers which are not sex specific, so for example, bowel cancer and lung cancer, which are two of the biggest cancer killers, men have a 67% higher chance of dying from those than women. These are the most common cancers in men: prostate, which obviously is a sex-specific cancer, lung cancer, bowel cancer, and those three make up over half of the total new cases in men. If you're not familiar with the symptoms of those, it's worth sort of thinking about it. Again, particularly as you're getting older, as you're moving into your 50s and 60s, prostate is, you're going to have issues around peeing and difficulties doing it or doing it more frequently. Lung cancer, obviously, is coughing and difficulty breathing. Bowel cancer, blood or other problems with your stools. But you know, that's worth checking all of those out as you get older. Another big killer of men, unfortunately, is suicide. 3/4 of suicides are by men. It's the biggest cause of death for men under 50, and there has been a sharp increase in the rate amongst men aged 35 to 64. So we're seeing this increasing problem with suicide in men in middle life. One of the reasons why men's mental health challenges sometimes end in suicide rather is that men are more likely to turn to alcohol to deal with difficulties, to self-medicate rather than talking about their problems, to find ways out of them in different ways to change the way they feel in the moment. Alcohol, drugs, gambling, or other sorts of potentially addictive behaviours And this alcohol and those other behaviours increase the risk of suicide, and with alcohol the risk's 8 times greater. So mental health challenges plus alcohol is a very dangerous cocktail. We have to mention diabetes these days because we now know that 1 in 10 men have diabetes. Middle-aged men are twice as likely to have it as women, and they're twice as likely not to know. So there's a big problem with diabetes in the population in general, but in men specifically. Most of the factors involved in type 2 diabetes are preventable, and so it's a really good example of a disease that by changing your lifestyle you can do a lot to reduce your risk of, not completely eliminate it, but do a lot to reduce it. So being sedentary, being overweight, smoking too much, excess drinking, diet, all of those things can increase your chances of developing diabetes. Brief word about coronavirus. We do seem to be in this phase where we're having little waves of coronavirus still. It hasn't gone away. There seems to be a little bit of a wave going at the moment, and there probably will be again in winter, which may be more serious. Men need to be careful when it comes to coronavirus because at any given age, they're twice as likely to die of COVID-19 as women. Obviously, the number of deaths, the mortality associated with COVID has gone down massively because of the evolution of the virus, and particularly because of the vaccines. But that doesn't alter the fact that men are at higher risk. And I mentioned earlier that there's no genetic reason why the men should be dying at 72 when they could live to 94, but there is a bit of a biological explanation for the reason why male life expectancy is shorter than women. Male life expectancy tends to be 4 to 5 years shorter than female life expectancy in England, and it's estimated that about 1 of those years is down to biology. So 3/4 to 4/5 of the difference between male and female life expectancy is down to lifestyle factors, but there is a proportion that's down to biology, and that's also plays into our increased risk of coronavirus. We're more likely to catch those sorts of things. So contrary to popular belief, man flu is real. We do tend to be less effective at fighting off those sorts of viruses, and this which is all to do with chromosomes and hormones. So the risk of COVID increases if you're older, from some ethnic minority communities, overweight, have diabetes or some underlying conditions like lung disease. I mean, you probably know all of this stuff already. And some occupations are at increased risk too, and they're often occupations in which we find a lot of men. So we're talking about drivers of public transport or taxis, security guards, those sorts of jobs. Now at this point, we sometimes do a quiz. When I'm hosting this on the Men's Health Forum platform, we do a quiz at this point, and we'll ask people about their health behaviour. So you just ask yourself this question. How many of these 4 health behaviours do you actually do? Not smoke, drink fewer than 14 units of alcohol a week, eat 5 fruit and veg a day, take at least half an hour exercise a day. And obviously, Man MOT is, as the name suggests, for men, but these questions apply to any women who are online today as well, because obviously these things are good for us whether we're male or female. Not smoking, drinking fewer than 14 units of alcohol a week, eating 5 fruit and veg a day, taking at least half an hour exercise a day. Why do I mention these 4 things? It's because there has been research done on those, and these 4 things together, research shows that doing all 4 adds about 14 years to your life. So we're already making big strides in improving our life expectancy by doing these 4 behaviours. I imagine that everybody out there knows that these 4 things are good for us, but I think it's useful to know just how good they are. And for men particularly, I think we like to have a number And the number of 14 years, I mean, that's a long time. That's enough time to see your grandchildren grow up. That's 3 World Cups if you're interested in football. So definitely worth having those extra 14 years. Now, as I said, all of you probably know that those 4 behaviours are good for you. But if you don't do all of them, what is stopping you? I would like to use the chat again here if we can. What are the barriers that you've got? What are the things that prevent you from doing these things? So perhaps type some of the barriers that you find to being healthier in the chat box. I'm not sure if I can not see these now. I'm not seeing anything come up now. Anyone got any reasons why they find it more difficult to follow behaviours that they know to be healthy? Reasons why can't stop smoking, reasons why we drink too much, reasons why we don't take enough exercise, reasons why we don't drink enough, eat enough fruit and veg. Thank you, Luke. Work drinking culture in the UK, that may be a barrier. This is a really good one, Jamie. I've not seen this one before. Fruit and veg more difficult. 3 of us in the house have different dietary requirements. Son eats junk, wife veggie, me normal. Okay, well that's really interesting. The difficulties that our different choices in terms of what we eat might make. Anybody got any other thoughts? Okay, because normally I use this to get an idea of which issues I need to talk most about now. But anyway, let's carry on. Anyway, this will be helpful for people who are watching it later as well as people who are watching it at the time. Easier to relax Friday nights alone due to family challenges. To crack open a bottle. Yes, I can see that. Smoking. There can't be a person on, certainly in the UK, I was going to say on the planet, that might be an exaggeration. There can't be a person in the UK who doesn't know that smoking is generally bad for your health. However, last set of statistics show that 17% of people in the UK smoke. I think the next lot may be slightly higher, and there is some evidence that young people have started smoking again, which is a bit worrying. So there are various things that if you want to quit smoking that you can do if you've stopped and you've got a craving, and there's a little list of them here. Talking to someone, going for a walk or a run, drinking water, nibbling on a carrot or other healthy snack, getting a change of scene, and getting yourself busy. All of those things will help, and it's very important not to have just one. People often ask whether vaping is a step in the right direction, and I'd say it is a step in the right direction if you smoke, but if you don't smoke, it's not a safer way of doing it, because vaping still means that you're addicted to nicotine, which means it's much easier to slip back into the habit of smoking, or if you've not smoked before, to graduate to smoking as a better nicotine delivery system. Yeah, vaping, step in the right direction if you smoke, not at all a good idea if you don't. I mentioned alcohol there, and this can be a real challenge. It was mentioned in the chat there. Drink easier to relax on Friday nights alone due to family challenges, hence cracking open a bottle. So there may be some things here which are pertinent, really. Drinking water, just drinking water as part of your day. We used to hear this a lot. You know, we were very strongly encouraged to drink 8 cups of water a day and all that. And there was a lot of feeling that, you know, people were dehydrated and all that. I'm not necessarily saying you need to drink 8 cups of water a day, and I'm not saying don't drink tea and coffee and stuff. However, making sure that you are properly hydrated and you are drinking water will probably reduce your desire for alcohol, simply because you're not actually drinking because you're thirsty. So you can take that out of the equation. The key test around your relationship with alcohol is to stop for a week or a month. Stop for a week. If you can stop for a week, great. A little bit later, try and stop for a month and see how you get on. If you can't do either of those, if you can't stop for a week, you really need to talk to someone. If you can't stop for a month, I think the same still applies. It suggests that you've got a relationship with drink which is beginning to balance in and giving drink more power than it perhaps should have in that relationship. I think that's the way to put it. Even when you are drinking, it's important to choose some no drinking days every week. If you always have a drink at a particular time or place, cut it out and see what difference that makes. So if you're always having a drink when you come in from work, or if you're always having a drink, on a Friday night, or if you always have 2 pints on the way to the football, take those out and see where that gets you. Recording what you drink for a month can help. Just seeing it in black and white, and obviously there's apps which will help you do that as well. Just seeing it in black and white can make a massive difference. This is a really helpful one, I think. Finding a non-fattening soft drink that you like, something that you're happy to order in the pub or drink at home when you might otherwise be drinking. My personal choice would be lime and soda, which has the other added advantage of being cheap as well. Other things you can do: think about choosing lower strength versions of drinks. So choosing the lower strength beer or whatever can be helpful. And frankly, compared to how they used to be, the no alcohol versions of beers and wines are a lot better than they used to be. So definitely worth looking into those. This is a real challenge. Someone mentioned the drinking culture. Try to avoid rounds. It can be really difficult to do that, and that in a way is possibly the hardest one to do, but the most useful one. And getting used to saying no thanks every so often will help as well. So all of those things, none of them are impossibly difficult, but just picking one or two of those which might work for you can make a massive difference in terms of the amount of alcohol you regularly consume. So I'm suggesting that you try a few of these ideas. If you can't do them, you try something and you just can't do it, you probably need to stop drinking for a while to reset your relationship with alcohol. And if you can't stop drinking, strongly advise you to get some advice. The Men's Health Forum teamed up with Drink Aware, and we produced a booklet called Serious Drinking. You can find that on our website. It's a short, sweet 20-page booklet. Covers the points I've made here, and obviously in quite a bit more detail, and all the facts and figures that you need about alcohol in the same place. So worth having a look at that if you're interested. The next thing on that list that would add 14 years to your life was eating better. And I'm not going to tell you here anything about what you should eat. And it's interesting. I see Jill's talking about the junk food culture, including home delivery. And I think home delivery has massively has made takeaways and all that sort of stuff massively more tempting and easier than they were before. You used to have to make the effort to go out in the rain, but now you don't have to do that, and that is a real challenge. But what I'm going to talk about here is nothing to do with without actually changing what you eat. It's just thinking about the way that you approach food. So I'm suggesting that it's helpful to sit down to eat. I think it's helpful to slow down when you eat and chew mindfully, to be aware of what it is you're actually eating. I mean, this sounds utterly ridiculous, but there's a massive amount of evidence that we tend to not really pay much attention to what we're eating. We're often doing something else. We're just refueling, really, rather than enjoying eating. Drinking water before and during the meal, I mentioned that before, but that can take the edge off your appetite, and it also allows your palate to enjoy what it's eating. Removing distractions, the TV, the phone, reading, when you're eating, all of these things can help you to pay more attention to the food that's on your plate and enjoy it more. So the whole point that I'm talking about here is not about enjoying food less, it's actually about enjoying food more, and enjoying food more might actually help you to eat better. Keeping a food diary, again, as with alcohol, just seeing it in black and white can be very helpful for helping us to realise some of the patterns that we're in. Maybe the over frequent packets of crisps or chocolate bars or whatever. Reading the labels so you know exactly what you're eating is worth it. Make sure that you understand how the food labels work. You do kind of sometimes it feels like you need a PhD in advanced mathematics to work out what's actually in the food that you're buying, but being a little bit more aware of that can help. And the other thing is, a lot of people kind of skip breakfast if they're trying to cut down, and I think that on balance the evidence around that is that that's not necessarily a good idea. Some people it helps if they're very disciplined in their subsequent eating, but for many of us it means that mid-morning we're absolutely ravenous and we start stuffing sweet things. So I'm talking about enjoying eating rather than changing what you eat. I'm talking about thinking about your food whilst you're eating it. I'm talking about seeing this as something that's a pleasurable and important part of your day. And the stats on the screen are really interesting, I think, in this connection. Enjoying eating may even save lives. In France, they spend 2 hours and 13 minutes a day eating. And 8% of deaths in France are estimated to be caused as a result of people being overweight. In the USA, it's the exact opposite. They spend about an hour a day eating, but 14% rather of deaths in that country are caused by being overweight. In other words, the French spend more than twice as much time eating as the Americans, but have almost half the risk of dying from being overweight. So we're not talking about taking food out of your life or making it a crime or something that you should be embarrassed or ashamed of, which is what some diets can do. We're talking about enjoying your food and seeing it as an important part of your life. And in France, where they do see it as the main thing, the French live to eat sometimes, it seems. That's one of the reasons why I think their relationship with food is healthier. And the forum's got a booklet on this as well, which covers these issues, but also the stuff I've not talked about today. In other words, it also talks about, what your diet should include and all those things, answers all the very common questions on diet. And that's called Eat, Drink, Don't Diet. So we're not saying that people need to go on diets. Our message is very much enjoy eating, enjoy drinking, and this is how to do it in a healthy and enjoyable way. And so the fourth one of those four things that add 14 years to your life was exercise. Now, normally when I ask this question to people, you always get people who haven't got time to exercise. So there's some thoughts here about that. Haven't got time. Exercise at home or in the park. You don't need to go to the gym. It's about building exercise into your day really. Getting off the bus or the train early or parking further away so you have to walk to wherever it is you're going. Cycling or walking instead of taking the car. Taking the stairs, not the lift. That sounds absolutely ridiculously trivial, but in fact the data on that is incredibly powerful, and there's evidence that people who regularly take the stairs rather than the lift have much better health outcomes than people who are using the lift regularly. So that's a really easy one that you can build into your day if you happen to work in somewhere or live somewhere where there's stairs and a lift. Use your lunch break. I'm talking before about the importance of enjoying your food, and sitting at your desk quickly grabbing a sandwich is probably not the best way to enjoy your lunchtime. And I'm strongly suggesting getting up out of your desk and going for a walk, and perhaps going somewhere nice to eat your sandwich. And obviously you get the exercise from the walk as well. Housework and gardening are good ways of building exercise into your day. Playing with your kids, for example, is a good way of building exercise into your day. And walking and talking when you're on the phone can be helpful, as can standing meetings. Standing meetings are really good for two reasons. One, obviously you're standing up throughout the meeting, which is good for you. But also the evidence is that the meetings last much less time and are more business-like. So two good reasons for standing up for meetings. People also often say that they can't really take exercise because they're too out of condition. And if you are seriously out of condition, obviously you do need to get some advice. Especially if you've got a long-term health condition, you're obese, or you haven't exercised for a very long time. But every little helps, and there's evidence showing that walking, even very slowly, which is about maybe 5.5 miles a week at just 2 miles an hour, which is about half the normal walking pace, even at those very low levels, walking will have a massive benefit for your health, and it will help you to do the next bullet on the slide, which is worth thinking about. The least fit 20% of the population are twice as likely to die than the second least unfit 20%. So if you're in the fifth of the population that's very, very unfit, just getting yourself out of that group into the next group of people who are just pretty unfit. So we're not asking you to suddenly become a marathon runner, just getting yourself from the 20% who are least fit up into the next 20% will halve your chance of dying in the next 10 years. So, you can make a if you're starting from a low base, every little really, really will help. And an example of, one way you can go from being very out of condition to being much fitter is to look at the Couch to 5K, which is the NHS 9-week program, which does what it says on the tin, gets you off the couch and completing a 9K walk or run within 9 weeks. So those are the 4 things. Those 4 things, as I said, will add 14 years to your life. And this will be added to some research at some point, I'm sure, because we know that there's one other thing that's as unhealthy as smoking, which isn't in that group of 4. And I think after the pandemic, we all know what this is. It's isolation, it's lack of contact, leading to loneliness and poor mental health. So being unconnected, lacking connection with others, especially as you get older, can be as dangerous as smoking a packet of cigarettes. I'm just looking at some of the stuff that's coming in on the chat. Thanks for this, guys. Everyone has time to do some form of exercise, says Julie, even if it's just having a quick dance at home along to a song you like on the radio. That's what I do, and it works for me. Actually, Julie, that reminds me of a new publication that we're putting out for Men's Health Week called the Can Do Manual, and I will mention that because that does actually talk about exactly that, about putting your favourite song on and dancing around the house. So, question to ask yourselves: do you have someone you can really tell anything? If you had an addiction issue, if you had a breakdown, if you were involved in a breakup, had a bereavement or bankrupt, so these kind of serious, sometimes difficult to talk about issues, do you have someone that you can really talk to about those things? Ideally, you want more than one person. It's good if some of them are outside of your family, because your family are often involved in these things in a different, more intimate way, which can make it more difficult to talk to them about them. So that's something to think about. So we've got this thing, as I mentioned, called the Can Do Challenge. This is something that the Men's Health Forum is right behind to encourage people in behaviours which will be good for their mental well-being. The Can Do Challenge, and the Can Do Challenge is an acronym which breaks down like this. C is connect, A is be active, N is notice, D is discover or learn, and O is offer or give. So those are the 5 things. You may have come across them before because they're called the 5 ways to well-being. There's been research showing that all 5 of these things are really, really good for our mental well-being. And obviously all 5 of them are things that we can do on a regular basis. As I say, we've produced a manual called the Can Do Manual for Men's Health Week, which is a free download on the Men's Health Forum website. And we've got 275 of these activities, things that you can do to be healthier in there. And one of them, as Julie mentioned, is dancing along to the radio at home. So this is what the Can Do Challenge is about. It's about connecting. It could be meeting a friend or colleague, texting an old mate, calling your mum. All of these things, the sorts of things that we can do to connect. And I've just said that lack of connection is as bad for you as smoking 20 cigarettes a day. So it's just incredibly important, not for our mental well-being, that we try to connect with other people. And that can, meeting people in real life is obviously better than texting, but texting is better than nothing. And keep in contact with people, especially old friends, and that is incredibly important. It's not just about, and this can be sometimes a problem for men. We tend to outsource this aspect of our lives often to our partners. They arrange our social lives and this, so we gradually more reliant on our partners for our social life, and that can be difficult if we find ourselves in a position where we haven't got a partner. So it's important for men to take control of this and keep up your own connections, keep up with your own friends. I can't overstress that really. Obviously, we've already talked about exercise. So as well as the benefits that it brings for your physical health, it's got massive benefits for your mental health as well. And there's, because of the endorphins that physical exercise gets, they're really good for their feel-good hormones. They're going to make you feel better. So all of that stuff that I talked about activity and physical health is equally important for your mental health, which is what makes it. If the benefits of exercise could be put into a tablet, everybody would want the tablet. It's that good. So some of these other ones perhaps are a bit less obvious. Notice. What do we mean by that? Well, we're talking about turning off your phone and trying to do things in a new way. So that could be a new route or a new journey. It could be drawing or painting something. It could be taking photographs. It's about looking up at the clouds and the buildings rather than looking down at your phone. It's about what I suppose we could call everyday mindfulness. Mindfulness has become very popular, rightly so, over the last sort of 10 years or so. And by notice, we mean practice everyday mindfulness. It's about trying to live in the moment that you're in rather than worrying about the past or fretting about the future. So that's notice. On the Men's Health Forum website, there's more about all of these things. And as I say, you can download the Can Do Manual as a free download. Discover, learning more new things is fantastically good for your mental well-being as well. So some ideas that we've got for that: read a book, a real one maybe, trying a new hobby, visiting a new place. There's 101 things you can do, and it's never too late to learn. The benefits of learning are like you benefit from what you learn, but you also benefit from how you feel about the fact that you've learned something new. And again, that's something that has more impact as you get older. We kind of take learning for granted when we're younger. As we get older, we kind of neglect it, and it's just as powerful when you're older. In fact, in some ways, it's more powerful. And obviously, keeping your brain active is going to be helpful for your well-being in the long term, and beating some of the age-related diseases like dementia. And lastly, offering or giving is amazingly good for our mental well-being. You know, sometimes I think people misunderstand what giving to charity is about, what volunteering is about, what everyday kindness, smiling for no reason is about. They're not about altruism. Altruism is a very selfish thing. You are going to get just as much out of doing this as the people that you're showing kindness to, and there's no reason not to accept and acknowledge that. That's a perfectly good reason. It's fantastically good, not just for the people that you're helping, but for you too. Julie says she's a dancer. Was out almost every evening before the pandemic, and then started going out less. So they put on the music and started doing it at home with her partner. So yeah, absolutely. There's always a new way to exercise. Thanks for that, Julie. So that's the Can Do Challenge, the 5 ways to well-being. Really easy way to remember it with the acronym Can Do. When we connect, keep active, notice stuff, discover more, and offer to others, we can do a lot to improve our own well-being. So I recommend the Can Do Challenge to you, trying to do one of those 5 things every day, perhaps trying to do all of them every day, perhaps doing a different one each day of the week. There's also whatever kind of works for you, really. There's all sorts of ways of making the Can Do Challenge work for you. So that's mental well-being. So that would be my 5th thing that you need to sort of keep an eye on if you're going to give yourself an MOT. I'm saying if you find any, when you look at those areas of your life, if you've got things which are causing you concern, you should definitely seek help now. It's very important at this moment as we come out of the pandemic. But I think it's also really important that we take advantage of what the NHS offers in terms of screening. There's evidence that men are less likely to take up offers of screening than women. A lot of evidence for that. And there's 3 things currently which are available to men. As I said, I mentioned the NHS health check, which a GP should be offering from the age of 40 plus. Understandably, because of the enormous pressure they're under, they may not be publicising that as much as they should do. But if you haven't had one and you're in your 40s, you should ask. Bowel cancer screening kicks in at the age of 60, and you get invited to do that by home testing. The government has promised to reduce the age for bowel cancer screening to 50, but that seems to be very slow, which is, obviously a shame and a disappointment, and seems to be of a piece with some other promises. But anyway, the other form of screening which is worth being aware of if you're a bloke is that for abdominal aortic aneurysm, which is a form of heart problem which can be very serious, and there's a one-off kind of screening process for that at the age of 65. So 3 screenings that are worth knowing about. At this point, I always mention my mate Phil, who died when he was 56 of bowel cancer. Phil was very fit. Even into his 50s, he was playing rugby. And when he started getting pain in his back, he was convinced that it was a rugby injury, or he managed to convince himself that it was a rugby injury. He didn't want to go and see the doctor because he thought that the doctor would tell him, well, mate, at 56, you should probably stop playing rugby. So he didn't go. He didn't go to the doctor until basically his wife dragged him along. Now, whether she'd got him to go earlier or not, whether that would have saved his life, we don't know that, obviously. But obviously it would have massively increased the chances of that. And so by the time he did go, it was too late. And the fact that bowel cancer is being seen more and more in people in their 50s, like Phil, is one of the reasons why campaigners have been calling for the age of bowel cancer screening to be reduced, and why the government have, as I say, said that they will do something about it, but they haven't done so yet, unfortunately. I think it's being piloted in some places. It certainly was before the pandemic. And so that's it, really. If you want some more of all this, I've mentioned some of our publications at various times in this morning. But there's a Man MOT publication, which is another short booklet, which kind of talks you through your home MOT. There's the Man Manual, which goes into more detail about men's health generally. There's also a Man MOT for the mind, which just focuses on mental health issues. And there's currently as a free download is the Forum's Manual Size Isn't Everything, which is all about penis health. I mentioned erection problems as a warning sign for heart disease earlier, but it talks about everything, all questions that men have had of all ages around penis health. And the other free download we've got at the moment, as I say, is the Can Do manual, which has got loads and loads of can do ideas in it. So key message, if you are concerned, don't delay. Don't be like the guy in the cartoon. I've been putting off coming to the optician much too long. You certainly have, says the receptionist. This is the vets. So if you're concerned, seek help. Thank you very much, everybody, for listening. We've got about nearly 10 minutes left. I'm very happy to try and answer questions if there are any. But as I said before, I'm not a doctor. So that's that needs to be borne in mind. Over to you, Victoria. I can't see any questions in. Now's your chance, folks. We haven't actually had any questions come through, so please do feel free. If there's any, or if I can give you any more detail on anything that I've already mentioned, please do, and please do ask. And there's the facility for anonymous questions. I'm just having a look, see if we've got any. So someone's asked, how can I speak to an elderly male family member about concerns for their health? Well, that is a very good question. And it can be really, really difficult to talk to older people about their health, especially older men who tend to often be in denial. We find it really difficult to accept some of the inevitable results of aging, and it can be really difficult to talk. But I think the key point I'd make here is why is it that men don't want to talk about their health? The obvious answer you might think is because they're not interested in their health. That's not true. Men are very interested in their health. The answer is that we're socialized, strongly socialized as boys and younger men not to take health too seriously. We're encouraged, and it's not maybe not as bad as it was, not as strong as it was, but we're still encouraged to kind of be strong and silent. Boys don't cry. It's about being breadwinner. It's about being the risk taker, and all those sorts of things, and that can make it very difficult. So I think the thing that I would say is that the person that you're concerned about, the person that you're worried about, if you've observed it, it's possible that he has as well, probably is interested in his health and probably would like to talk about it. So it's about creating an environment in which it feels safe for him to do that. One way of doing that is rather than kind of sitting down opposite him and saying, okay, Uncle Fred, I can see this and we need to talk about it, we need to do something about it, is perhaps get Uncle Fred doing something that he likes doing, perhaps going for a walk, perhaps going to a football match or messing about with a car or whatever, doing something together. And then whilst you're engaged in this activity, just having a chat and just bringing it up as part of that. We talk about that a lot in the forum as being side by side. Conversations that are side by side are often easier for men to have than conversations that are face to face, which can feel a bit like a doctor and a patient. So maybe that will help. Someone else has said, thank you for promoting the NHS health check. I work in public health and go on about poorly it's publicised and how few people know about it. Yeah, I mean, it's really, really interesting. The NHS has got things going which are good, but because it's involved in firefighting all the time and it's got such limited resources, especially in primary care, it doesn't, publicise things which in the long term would help. So when we hear people like Sajid Javid, the health secretary, saying that the NHS has got enough money, those of us who work in health, and I'm sure the person who asked this question in public health would agree. That simply isn't the case, unfortunately. There may be an argument about where money should go, but the idea that the NHS has got enough money is quite ridiculous. Someone said, where can I download the Couch to 5K app? If you go on the NHS website and Google Couch to 5K, you'll definitely find it there. I can see the Men's Health Forum website, but is there a questionnaire type tool online where we can literally do a pseudo MOT? But if you're on the Men's Health Forum website, if you follow the links to Men's Health Week, and then there's a link from there to the DIY MOT that we're pushing this week. There's 7 self-tests that you can do there, and we'll be promoting a different one on each day of Men's Health Week. Today, I think it's about taking care of your engine, which is about your heart, basically. So there we are. Just going back to the comments to see if there's anything else there. Yeah, Julie talks about the barbers shops, and that's right. There are more and more barbers who have been trained in talking to men about their mental health, and that strongly, I think, backs up what I was saying. And some extent, that's kind of where our evidence comes from. So the guy is sitting in a barber's chair having his haircut, and the barber's chatting to him, and that's a far kind of less confrontational sort of conversation to be having than someone sitting you down, sticking a cup of coffee in front of you and saying, right, we need to talk about this. So that's a good example of, I think, side by side conversations being less threatening than face to face. Couple of minutes until I think I'm going to be booted out of the virtual village hall. Thank you very much, everybody who's come and listened to it, and hope it's been useful. And I also hope that other people will listen to it later on the catch-up service, which I know the RVS run. So thanks very much for coming along today, and thanks very much for your questions.